Hey everybody, this is Alex, healthhacksreview.com. So this is a video that is about, it's kind of an introduction, I guess you could say, to hyperbaric oxygen therapy, or in the case of what a lot of practices and clinics are purchasing and using, and residential users, we call it mild hyperbaric therapy. When you put the word oxygen in it, what that means is you're delivering pure oxygen tanks. Generally, you only see that at hospitals, those types of places. But in kind of these other sorts of situations, with mild chambers or soft shell chambers, they're using what we call an oxygen concentrator, which concentrates oxygen to 97%, which you breathe inside of the chamber. The chamber is the reason that it's inflates and it's fully sealed up. Is the goal is that you're trying to take that concentrated oxygen and use some pressure. When you actually exert pressure upon the cells, the alveoli, and the lungs, basically what happens is you create a chemical process where oxygen can be dissolved into the fluids of the body. So we're talking about, the blood, of course, is then able to take up more of that oxygen through enhanced electron transport chain processes, and then also dissolve. This is kind of the real advantage or difference than just breathing in pure oxygen. For example, when you have it under pressure, what actually happens, and science actually still doesn't have all the mechanics on how it actually dissolves as effectively as it does, but it dissolves into the fluid around the cells. So now we're talking about a saturated water solution that's higher in oxygen that the cells can just readily take into the interior portions of the cell, versus just relying more exclusively on blood actually delivering the bulk of the oxygen. So this is really where you start to see all those miraculous, amazing recoveries, because we're really, really dramatically uptaking and upscaling oxygen saturation, because again, it's dissolving into the actual water fluids itself. And so this is, again, because oxygen is such a fundamental process for health, for cell function, metabolism, just everything. It tends to help with pretty much any major health condition. And of course, they're also using it in, athletic and high performance competitive sports. It's very well accepted there, because you don't have to be sick to be using one. Having those additional energy resources and oxygen really does a lot of enhancements to all sorts of different aspects of the body for a variety of different purposes. Now, the question that a lot of you might be asking is, does it work? Is there any proof to that? And the answer is absolutely yes. So there's been a few hundred studies at this point, and I might add those peer-reviewed, published studies were very impressive. They very much can be even measured, like in the case of brain injuries or brain problems in general, brain conditions involving the brain. They've really been able to analyze and measure with different sorts of brain scanning software, MRIs, things like that. Major changes from before getting the treatment to a major change in brain state right after even one treatment. And so far, there hasn't really been, except for transcranial magnetic stimulation types of technologies out there, there hasn't really been something that affects the brain that effectively, that quickly. In fact, further proof that this therapy does work is, you're free to look up and do a little bit of research here, but the US government and military industrial complex just spent multi-million-dollar, very, very large contract to an individual that I know, and their company. There's actually a couple companies that have received the funds from the government for building large multi-chamber units for veterans of the military. Okay, so even as recent as the Afghanistan, Iraq type of military situation, and stretching back even further. So this is the main form of treatment that the military has decided to get behind as the fastest way to help with a lot of the problems that we're seeing with veterans coming out of the military. That's why most chamber companies offer, military discounts, things like that, which are actually quite very significant. The discount is because of a lot of the problems that we have seen, even from Gulf War syndrome, things like that. There's a lot of inflammation, PTSD, which has been helped a huge amount, because PTSD is a type of trauma and also that PTSD can also be due to concussive sort of blasts of fire, of bombs, I should say, which can cause concussions and different sorts of states in the brain that then, with that trauma, have reduced oxygen flow, then cause lesions, things like that. So there's a lot of different sorts of situations that are affecting the body on a very core cellular level. That have been affected. So the military has gotten behind this big time. They're building huge units where 25, 40 veterans can actually go in and all get simultaneous treatment, because there are thousands and thousands and thousands of veterans that are actually having a variety of different health problems that can be helped by chambers. You're free to look that up. I don't think the government, the military especially, would get behind something with tons of money, tons of millions of dollars, if the therapy actually wasn't working. And also consider that they evaluated several other kinds of therapies. They obviously did their homework before they poured all this money into it. These units are very expensive to build that large, very expensive, multi-millions, just for one unit. So the therapy absolutely does work. I also know personally, I'm not just a salesperson who's going to sell some hyperbaric chambers, things like that. That's not what I'm about. I have relationships with all the different manufacturers in the industry. I also have really good relationships long-term with different sorts of hyperbaric clinics. So a lot of the places I've learned also a lot of what hyperbaric therapy does do and does not do, how it helps different things, or vice versa might not, is from the clinics themselves. Who better to talk to, right, than somebody who's run a clinic for many years, has worked directly with patients, and seen thousands of cases of all sorts of different conditions, all sorts of different demographics, and seen exactly what the therapy can do, how many treatments, what might be the typical progress, you name it, right? Versus you're calling up a hyperbaric chamber company, you're calling up Oxy Health or Newtown or Summit to See. These are pretty much some of the main ones. And you're talking to who? You're talking to a salesperson, right? Who actually legally can't even talk to you about your health condition. Legally, you can't do that, according to FDA. So that's not exactly that helpful, when you're trying to have a little bit more of a personalized discussion for you, or for your patients, for the type of conditions and the type of results you can maybe expect to see, exact ROI and things like that. So I have those connections in place. You're welcome to send an inquiry if you have anything like that, and I'd be happy to help you basically figure out what brand is going to be good for you, and you can see a little bit of a review of each of the main brands. There's really only 3 or 4 in the whole industry. Just kind of refreshing compared to some of the other product categories out there on the site where there's a million brands. Anyways, if you have any questions, send me a message, or you're free to call me and set an appointment. Thank you.